Great. Thank you, Trey. Good afternoon, everyone. Welcome and thank you for your time today. Really appreciate it. Delighted to be here today talking about what I think is a terrific use case, and really grateful for all of your time. Before we get started, I just thought I'd do a little bit of a preamble here to get everyone grounded on the topic at hand. Obviously, this is a healthcare-focused webinar that talks about remote patient monitoring and telehealth. But I think it would be useful to just take a step back and think about the broader macro conditions in healthcare. So the first thing I'll talk about is a statistic, which is that healthcare spending in the United States totals about 18% of our GDP. This, as we all know, is an astonishingly high number, but yet we continue to use the same old playbooks in healthcare. And something has to change, and we all know this. The second is that during the global pandemic, as devastating as it was for most people around the world, there were two silver linings that came out of it. One was the stunning pace of innovation, especially when it came to vaccine development. But the second was that we all realized that healthcare specifically, no longer needs to be confined to the four walls of a hospital or a care facility. Your data is available, your healthcare data specifically is available and can easily be shared with healthcare providers. And that's something that we continue to see growing as a burgeoning trend. And the third key topic and observation that I wanted to touch on was specifically around healthcare itself. We're moving from a very sort of one-size-fits-all paradigm that was not data-driven to a more proactive model that is data-driven and increasingly becoming highly individualized. And we want that type of model to exist for everyone, not just the people who have the means to do it, but also those who do not have the means to get good healthcare. And this brings us to the topic of health equity, which is exactly what Evexia is trying to solve for. And you'll hear a lot from them today. So where does Blues fit into this equation? Blues' mission as a company is to transform physical products into data aggregators that you can get intelligent insights from. And that applies to pretty much anything you can think of that's the physical product, whether it's an oximeter in the healthcare case or a blood pressure monitor, could be environmental monitoring, the air we breathe, which is a very germane topic for a lot of us in the United States, at least with the wildfire smoke impacting us. That also impacts our healthcare. And so our mission has always been to make that connectivity from the edge to the cloud secure, reliable, and most importantly, extremely cost-effective. We're at about 1/10 the cost and complexity relative to other players in the market. So that's always been our mission, and it applies very nicely to healthcare, as we'll learn about soon. Blues itself was founded in 2019, although the origin story for the company goes way before that, all the way back to 2011. We're founded by a gentleman by the name of Ray Ozzie. He's a repeat hyperscale founder. He was the founder of Lotus Notes back in the day. He also wrote the first memo on Azure, the cloud services memo that is pretty famous. And his mission has been and continues to be to build the first hyperscale cellular IoT solution. Our flagship product is a product we call the Notecard. I'll be talking about it. We have some images of it, but it's effectively a postage stamp sized little system on a module that simply quickly and easily connects edge physical devices to the cloud and sends data back and forth. We've got over 1,000 companies that are betting on us, from small startups to large enterprises, and they use Blues to securely connect their devices today. Our core goal has been to lower the cost and complexity of cellular connected products specifically. There are several ways to connect your products. Wi-Fi is obviously one of them, and Evexia will talk about some of the challenges there. Cellular has become one of the more popular standards because it is the most secure, ubiquitous connectivity technology that exists, but it can also be very complex and very expensive. And so our mission has always been to make ourselves available to those who have faced those challenges and make it extremely easy to provision your devices very securely, and optimize the data that you're sending to the cloud back and forth. So we'll talk a bit about the note card here. It's chock-a-block full of features, of course, as you can imagine. The most important one is, I'll touch on three here. The most important one being that it comes with cellular data pre-baked within the note card. So we have a pre-provisioned SIM card that comes with 10 years and 500 megabytes of data. So you don't have to worry about that provisioning process or negotiate with a cellular provider for that. You'll never have to pay a monthly data fee, a monthly active SIM fee, an activation fee, or a deactivation fee. It just works in 140 plus countries. We're also extremely low power. So at steady state, we're drawing only about 10 microamps, which for context is less than what you would see as current draw from a standard LiPo battery. And we're very, very low bandwidth. So when we're sending this data, these little packets of data that we call notes that are effectively JSON objects, there are hundreds of bytes of this data, and we're compressing it over the air. So you can maximize your data usage as you go along. The other key element here that is very germane to healthcare and many other industries is security. We hear about denial of service attacks through Internet of Things devices pretty regularly. And one of the things we've done is on the note card, we have a secure element. It's an ST-safe security chip. And what we do with that is at the point of manufacturing, we bake in keys and certificates. So what that means is when the note card wakes up anywhere in the world, the first thing it's going to do is a handshake with our cloud service to make sure it is in fact the note card that we believe that it is. So nobody can do a man-in-the-middle attack and intercept this data. And all of that data that flows from the note card out to the cloud never touches the public internet. It goes through our APN to our virtual private cloud, and you can end-to-end encrypt that data from your edge device to the cloud and back, which is very, very useful, especially for healthcare use cases. There's several other capabilities here, but I don't want to spend too much time on feature and function. But those are some key elements that really draw people to the technology today, especially when it comes to sending and receiving data from your edge devices. The other element of the solution that we have is a product that we call the Note Hub. This works in conjunction with the note card, and it's simply a thin Internet of Things infrastructure layer. It's helping you manage your devices, do over-the-air firmware updates, manage your data, and then route your data. All you need to do is get that data from an end device, whether that's an oximeter or a blood pressure monitor or whatever the device is, and simply pass it on to your cloud service of choice. That may be any number of different things. And it acts as a command and control center for hundreds of thousands of devices, or even one device if you're starting with one. And that's been our claim to fame. The key element of this is that the business model is extremely attractive for our customers. So as I mentioned, you're never going to pay a monthly data fee, never going to pay an activation fee or deactivation fee, no monthly active SIM fee, but you will also never pay a subscription. You will only pay for what you use, and the more you use, the less you pay. So it's purely a consumption-based model, which is also very attractive. So how does this work in practical terms? So in this case, we've got an Evexia Bluetooth cellular gateway. The note card simply pops in via an M.2 connector onto one of Evexia's boards. That speaks to an oximeter or a blood pressure monitor or whatever the healthcare device is. We don't lock you into the choice of host microcontroller, so you can use a Raspberry Pi, an Adafruit Feather, Arduino, ST, whatever your host microcontroller is. We don't force you into one architecture or another. That data then simply flows through the note card. We have a simple JSON over serial interface, so you can use USB, UART, I2C, and then it flows to the Note Hub. And then from the Note Hub, you can route that data to any endpoint of your choice. You can visualize it in any cloud service that you choose, whether it's Azure, Amazon, Snowflake, PTC ThingWorks. You can use an MQTT broker. You can use your own HTTPS endpoint. And so what this does is it's a very simple, seamless way to just simply plug in the note card into your edge device of choice, send data, and also receive data. It's bidirectional. And Francois will talk a little bit about this as he discusses the solution. And so all of this lends itself really well to this new model of virtual care, where more and more people, no matter where they are, no matter what their means are able to get their data easily to a care provider who can analyze it, interpret it, and give them some insights about it. So with that, I will pass this on to Francois, who's the founder of Evexia. It's been a pleasure talking to you. I'm still going to be here after Francois is done. And by way of introduction, my name is Pavan. I head up sales here at Blues for the East Coast. Thrilled to have you, Francois. Thank you for your time today. And the floor is yours. Francois, I think you are muted.
Okay, sorry about that. So the reason we're here is we're based in the U.S. Virgin Island, the Caribbean, close to Puerto Rico, and we've been involved in healthcare for about 10 years. And about 3 or 4 years ago, just before COVID, we realized that only some of the patients were receiving remote patient monitoring care from the health provider. We manage the back end of about half of the population for the hospital, the private practices. And the introduction of remote patient monitoring systems, several of them coming from the States, turn out not to meet the needs of the population here, the characteristic of the population we have here, which is isolated. Many of the patients are older, living at home, and I'll talk more about this. Many of them do not have access to healthcare, either because they don't have the means to pay for it, or simply they're not getting the ability to travel to their health providers. That includes obviously seniors, elders, but it also includes the need for them to understand and use devices. What we've learned is in the slide that Pavan just put up, the key part is the technology barrier, meaning that using a smartphone, and we tried with different solutions, even connecting to Wi-Fi is a challenge for many, many people. Perhaps not any of us on this call, but it is a challenge for seniors and for a poorer population that either doesn't have access to Wi-Fi or simply doesn't know how to access Wi-Fi if it's been set up by one of their relatives. Most of this population also doesn't have a cellular plan. Data plan is expensive. It's complicated. You have to have a smartphone. You have to keep your smartphone charged, which is not obvious when the electricity and Wi-Fi goes up and down the whole day. So we designed a system, and that was really the first twist. How can we make it so simple that all the patient would have to do is use their medical devices, whether it's a glucometer, whether it's an oximeter, whether it's the standard blood cuffs that everybody's familiar with, and apologize, a bit blurry, or thermometer. All they need to do is know how to use that device. What we have is the Evexia gateway, as we call it. The patient plugs it into the wall, and that's it. Never touch it again. There is no button, there is no screen, there is no keyboard, and there's nothing else to be done. There's lights on them, obviously, and there's a speaker on them. And I'll talk about this in a minute. The goal is to remove all those obstacles that we had seen in the past, and we've seen that before COVID, and certainly during COVID, when patients were sent back home if they were not critical from the hospital that's somewhat functional here only. They were sent back home, and we had no way of monitoring with, again, an oximeter to see if their condition was degrading in such a way that they probably had to be readmitted into the emergency care. So the idea, again, is to keep it extremely simple. The device, the Evexia gateway, gets the data from the vitals, and if the internet is out, if the Wi-Fi is out, the power is out, obviously if the power is out, the Evexia gateway goes down, comes back up. When it comes back up, through the services of Blues Wireless, the data gets brought back up. And what I want to stress is there's a distinction between preventative care that Pavan touched about and the regular monitoring. Some people have those little, chips you put on the arm. Great, it's covered by the insurance, or they have the means to pay the $300 for that device. Again, not the situation. We're talking about a situation of somebody's early stages of diabetes or has a heart condition. So if we were to kind of look at the at the third slide, so Pavan, if you don't mind, we designed this to solve the issue of those that do not know how to use a smart mobile device, or don't have the means to purchase a smart device, don't have the skills or the means to have Wi-Fi, people that certainly don't have either the dexterity or the visual ability or the capacity of understanding how to interface with any device, a device that works when electricity comes up and down. And the one, and that's the last part I want to mention, is the part about engaging the patient. Because what Blues provide us, and I'll explain a bit in a minute how that simplified our process, it's a bi-directional process. Getting vitals from a patient is only half the battle. It's not a fraction of the battle if really nobody's looking at it at the other end. If the care provider, which are typically focused on curing, not prevention, that's the financial model behind healthcare in the US, they're only going to react at abnormal results. They're not going to engage the patients in improving their diet, exercise, communicating with them, motivating them to take some actions, typically lifestyle changes. That holds for the families as well. The families doesn't have to be a licensed healthcare provider, and our system is bi-directional, meaning that simple voice messages can be played back through the Evexia gateway to the patient. Hey, Mrs. Jones, we notice your blood sugar is going up. Are you watching out what you're eating? That could be a family member sending it, or a caring caretaker, a community member even, or it could be something more important that would be scheduled every day. Do remember to take your medication. It's a key issue in healthcare, as I'm sure many of you know, that prescribing medicine, particularly to the elderly, and having them take it is an entirely different story. So a simple reminder, friendly reminder, it could be, of course, in any language, in Spanish, in Creole, French, English, just remind them, hey, great job on your blood sugar, but do remember, positive message, do remember again to take your medicine with food in the morning. So this concept of bidirectional communication that we added is one where we try to alleviate the lack of interest, to be polite, in many of the healthcare providers in providing and engaging the patient before they get into a situation where they become billable. That's a reality. That's what we do with the system. And because we're not technologists, we tried a variety of technology over the years, from LoRa network to those kind of chips you insert to Wi-Fi. What we found is that the ability we've had is we had to focus on Bluetooth. That's the part that, of course, unfortunately, Blues cannot help us with. But after that, once we captured information at either end, either to be sent as a voice message or to be held back up as a vital, It took very few lines of code. We didn't have to have any finger pointing as to, whose cloud is it, what security system, do you have the right keys or any of this. We just submit it, it routes via the Notehub into our own cloud-based system, and same on the way back down. So that the simplicity was, on one hand, the template they provide us with, as well as the one-stop shopping where we don't have to worry about if something is going wrong, where it's coming from. Is it AT&T? Is it, is it the device? Is it the Wi-Fi? Is it something else? So in a nutshell, and I know I'm sharing a lot of information, the reason we went down this path is because, again, we get to focus on what we think we do well, which is engaging patients in a preventative care model, as opposed to building technology.
That's great. Thank you, Francois, for that. Very, very illuminating. Could you touch on, there was something you mentioned here about the provisioning process. First, could you share with the audience how many emergency room beds actually are in the US Virgin Islands? Actually exist?
Yeah, so on the island of St. Croix, population about 50,000. It's supposed to be 12 beds.
12 beds.
Not all of them are functional. Matter of fact, at some point, one of the AC units on the roof of the hospital was neglected from a maintenance process, and at night emergency could not proceed because it was about 95 degrees in there until one of the AC units was fixed. So the last place you want to be is in the emergency room. And I guess if you have a worsening diabetes condition, that would be critical. Even the evacuation by plane has usually a wait list of 48 hours to be evacuated to Florida, because the plane's going back and forth all the time, and it's only one or two. The same condition holds in Puerto Rico, where people, in the hills of Puerto Rico, can be a long way away from the nearest hospital, even if there is a bed available to them. So we are really in a situation where preventative care in those rural, distant area, or those which are underserved by the healthcare system, can become much better way to handle than just wait until things go wrong.
Right. And so this your technology becomes even more critical if there are just 12 ER beds, in particular in the middle of a global pandemic. Not to mention even in a regular scenario, non-pandemic, so to speak, for healthcare. And so the Evexia technology has been, it sounds like, crucial to converting people's homes into effectively little mini hospitals where they're sharing data. Is that a correct assessment?
Yeah, that's the case. I think it's the situation where you get trends. I mean, we're using inexpensive, monitoring devices, and the glucometer, I think, is a $20 device, standard device. We don't make any of that stuff. So yeah, it's not something that would tell you right away in real time that something is going wrong. It's something like you're observing over 2 or 3 days, and you can see a trend. We have these, portals and tools for caretakers to see that. You can see that the situation is degrading. The O2 on the patient is going from 98, 97, 92. You're starting to drop below 90 consistently after a couple of days. Well, that patient is still not getting better, not critical yet, but not getting better. Maybe it's time to actually reach out with a professional healthcare, with a professional to the patient and say, hey, we need to talk to you here. And just even talking to them is not obvious, because remember, a lot of this population is using what everybody calls a burner, which is there is no phone number in the database of the healthcare provider that works all the time. In our case, we can send a message, say, hey, Mrs. Jones, call us, right? We notice your numbers are going down here, call us. And that might be the only way to reach them.
Sure. That's great. That's a great story. Could you, Francois, while we're on the topic, could you talk a little bit about the security elements? And before you answer, just a quick note for the attendees. I see some questions coming in. We will absolutely get to them. And I think some of this conversation with Francois may help answer some of them, but in the event that they don't, I will 100% make sure we go through every question. So Francois, the question was around security. So tell us a little bit about the security of this product, where the note card fits in. I mentioned the secure element, obviously, but I'd love to get your perspective on this as well.
Yeah, absolutely. I mean, I think HIPAA, regulations, federal regulation are not something to be toyed with. I think they are justifiably so, no matter what your position is on government intervention, are good measures. They are measures that ensures that patient information is not disclosed to unauthorized persons. It's quite a burden. It's a very heavy burden for an RPM company to meet that goal. They have to demonstrate that there is end-to-end encryption on one hand, and the other hand is they have to demonstrate that they're handling the process of that encryption properly. Now, of course, if you have to use your own keys as you would have in other systems, you have to manage your keys. Then you have to show that you have a process to manage the keys and renew the keys and make sure the right person have access to those keys and so on. In our case, I don't do anything. That key is burnt into the device. There's only one like that. We're 100% sure that when Mrs. Jones is sending her blood sugar, it is Mrs. Jones that's sending the blood sugar all the way into the time it gets to the caretaker. So, and then we don't have to file any additional paperwork because we don't know what is nobody has access to the data until it hits the final point.
That's terrific. That's a great point. You talked about the prototyping process a little bit, some of the capabilities. Could you discuss going from prototype to production, getting the data to your endpoints, and just the process of building this app up and scaling this up, both just in terms of your learnings and with Blues, of course.
Absolutely. So as I say, we've tried many things, before we run into Blues, and we run into Blues because I have a long connection to Rayosi from the Lotus Notes days, and we had tried many things. We had tried LoRa, and we turned out that deployment of LoRa was just not what it's supposed to be. The Rangers indicated it simply didn't work for us. The cellular third-party chips with the dongles turned out to be, for reasons I still understand, dropping all the time. And some of the other RPM companies that mentioned it beforehand that tried to implement here had similar issues where, well, for some reason, there was just not enough reception. We're always on a very, very edge of cellular reception, particularly in Puerto Rico due to the hills, also for the fact that there is no 5G here and 4G is borderline. And it simply does not allow the towers on the island because there's just not enough revenue for the carriers to justify putting additional towers. So on the edge, it turned out that we had issues with other cellular providers, not mentioning all the work we had to do to integrate. LoRa wasn't what it was supposed to be, and then Wi-Fi was just a nightmare. And where is my password? I got disconnected. I don't know. So from the time we got, I believe we were one of the early implementers, prototype of this, to the time we had actually data flowing back and forth both ways, 3 months. And that includes testing. Obviously, the first packet went through probably a few weeks, but by the time we were reliably moving stuff up and down and had all the quality assurance done, reasonably was 3 months from receiving the first units. And again, they were prototype. Documentation wasn't always there in the early stage of Blues, so we had somewhere to navigate. So I would say give yourself 3 months, and you'll have things moving reliably up and down. That's
great. Thanks, Francois. We've got a few questions coming in from the audience. I'll take the first one. It's about security. Somebody's asked about our Wi-Fi note card. Of course, Francois, you just mentioned that Wi-Fi has been very unreliable, and you don't want to rely on the elderly to connect to a Wi-Fi network. But nevertheless, we've got a question about our Wi-Fi product and whether it has the same security element or the secure element that I mentioned for the cellular note card. So the short answer is absolutely yes. The note card exists in a few form factors. We've got a narrowband product for the note card, a wideband product, which is LTE Cat 1, and we've got a Wi-Fi product. all of those products have a ST safe secure element with the keys and certificates baked in at point of manufacture. So you get that security that I mentioned, where the data that is flowing from the note card to the note hub never touches the public internet. You get that with all of our SKUs out of the box. And I think that's a pretty relevant point, especially when it comes to healthcare. One other question that has come in, Francois, is focused on battery life. So I talked about the low power nature of the note card. And it's really, the question is sort of what's some of the biggest hurdles to overcome with a connectivity solution in terms of battery life, signal reliability? How did you manage when you couldn't connect? Was there storing and forwarding of data, et cetera? Could you talk to that a little bit, Francois?
Yes, so obviously battery is the holy grail of all solutions. To be honest with you, we give up on that. So our system runs on a USB 5 volt. So any USB 5 volt battery pack is sufficient, to get the the Evexia gateway to work. And obviously all the medical devices are also battery operated. But the reality is, it's a store and forward mechanism. So, our system will last probably about a day on a battery pack. What we found is we told people, look, you plug this thing into the wall. There's lights that are clearly visible to indicate that, it's ready to receive information, or that a message just arrived, or a message is ready to be played, or that it's communicating with the the medical devices. So obviously a patient has to take notice that they shouldn't be trying to take their vitals if the device is actually off. Now, on the other hand, once the device is on and the vitals are taken, then they'll go out almost immediately. If for some reason we lose power right in the process and it only takes a few seconds, where the power went out, and again, it does go out just about every day in the Virgin Islands, and sometimes several times a day for a few minutes, or for much more than a few minutes. Puerto Rico is the same. In that case, as soon as the Evexia device comes back up, the note card wakes up. That buffer that the note card has, 2 megabytes, if I'm correct, Pavan, is sufficient for us to store our vitals, and vice versa. When it comes back up, the node hub is going to try to pass back to the Evexia gateway the messages that are going back down into the patient. So what we found is we give up on that store and forward mechanism. Goes down, it goes down. And in the case of severe weather, when we get hurricanes here, then our advice is, if it's going to last too long, either plug it into the generator. Most people have generators capable of charging a USB device, or worst case, you just plug it into your car. There's a little thing you put in your cigarette lighter for the older car. People don't have new cars there, so you plug that thing in, and it's good enough to take your measurement and have it sent up and down. So I guess I'm punting a little bit on the battery here.
No, that's great. That's great. Very, very, very good insights. We've got a few more questions from the audience. I'll take another one here. So there's a question about using this device in remote locations in Africa with low or no internet penetration. I assume they're also referencing cellular. So I'll just answer from a Blues perspective, and then Francois, obviously, you're welcome to add on to that. So the short answer to your question is yes, we do. The note card does offer connectivity in Africa. There are some countries that we currently out of the box don't cover, but the great part about the note card is that we can use SIM cards, local SIM cards from the countries that we don't have coverage. And we have partnerships with companies like Once, which offer terrific plans at a very low cost. And the note card will work with all of those. So I feel pretty confident that we can cover most, if not all, of Africa between those two things. In terms of the question about using the Evexia device in Africa, I'll just hand that off to Francois. Francois, do you have any thoughts?
Yeah, so we haven't tested in Africa. We've tested, all over Mexico, even the Azores, rural area in Portugal, Spain, France. And we've never seen an issue, especially in Puerto Rico. We drove all over Puerto Rico. And in places where the cell phone was absolutely, unable to make a voice call or maintain a data connection for email in and out, the Evexia was still able to receive and transmit vital, again, small packet. And again, we're not technologists there, but it seems to me that the note card is capable of hunting for signal, for the lack of a better word. So what I've seen is in places where my cell phone is roaming or doesn't want to roam, or again, there's no reception, somehow the Evexia finds, and the note card finds a tower somewhere or some carrier that is just enough reception to get the few packets of data we need to get in and out. So again, it functions well at the very, very edge of a cellular network when there's just no way you can get data or voice going.
Great, thank you. Yeah, so let me just sort of paraphrase that for the person who asked the question. So the short answer is that the note card will absolutely work in most of Africa. The longer answer is that Evexia, while they have not tested in Africa, feel pretty confident that if there's any kind of cellular connectivity, even if it's a low chance, we feel pretty good about that. The other thing I'll take this opportunity to point out that even in a scenario, we have newer products now, we call them Sparrow, and it uses LoRa technology. So you can create a little sparse mesh to then where these sensors talk to each other. And then even if you have one spot that has even one bar of connectivity, you can plug it in and have it always on. So we do have that ability as well. In terms of follow-ups for this, we're happy to sort of connect directly and discuss this. And we'll be sure to do that right after this call, and I'll get Francois in touch. There seems to be extreme interest, Francois, about our deployment in Africa. So great. Well, this is fantastic. So let's pivot back to one more question for you, and then and maybe we'll close it out. So I started out this webinar by talking about a statistic and a couple of observations. And the third observation was related to health equity. So how we're moving from a reactive care model to a more proactive, data-driven, highly individualized care model. That at least is the holy grail for most of healthcare to help and bring these costs down. In your specific case, how do you feel that this access to data will transform the lives of your patients? You've talked about simplicity. You've talked about, zero failures or minimal failures and high impact. Tell us about some stories of how this has impacted, how this access to data has impacted the people that have used it in the U.S. Virgin Islands.
Well, I think the health equity issue is really one facet of all this. What we're talking about is a healthcare system that's built on what I call break and fix. You just wait till something breaks and then you fix it, right? And that is certainly not motivated by any manner for preventative care. I think, and I believe that those patients that are involved, and I would even argue that it's less about necessarily the data that the medical devices are generating, but the fact that the patient is involved into their own prevention. By just using the device, they become aware of what's going on. And by being engaged, they seem to be participants in taking care of themselves, sometimes with the help of the family, sometimes with the help of a community leader. And that prevention step is one that has, there's always the aspect of healthcare, which is, there's the scientific part of it, and there's really the psychological part of it, which is, how do you make people that feel that they've been neglected by their family, by the healthcare provider, by the system, or do you feel that they take on some responsibility with the help, again, of other people in becoming interested in the option that they have to not end up in urgent care, on emergency care, because certainly none of the patients that had that experience, especially in emergency care in the rural areas, feel like they want to return back to that same position. So it's a multifaceted aspect, but it's one where the system right now is not going to change for the near future that I can think of. And again, not about politics. I just don't see it changing quickly. certainly not in the Virgin Islands or Puerto Rico, and perhaps even in some of the other territories in the U.S. I mean, think about the tribal lands, where getting help is half an hour away at least before you see any kind of medical personnel, or inner cities, no difference. So I think by getting the patient engaged with a simple communication, pieces of data that move back and forth, not always, sometimes they make it, sometimes they don't make it, creates an environment where there is a half a chance to get the patient to realize that they have to take care of themselves and have other people that watch them have an easy way to say, hey, that person needs a little help.
Great. Thank you, Francois. Absolutely. I mean, what a great story and what a great product. Thank you for all that you've done there. And it sounds like we might have some expansion in Africa. Let me see if there are any additional questions. Just give me one moment. There are no additional ones that I can see, but just for everyone to be aware, in terms of reaching out to us, we'll obviously be reaching out to all the attendees, and we'll be sharing a video that we've created with Evexia along with this recording, so you don't have to be screenshotting slides. If there's any additional information you need, obviously you're welcome to reach out to us directly. sales@blues.com is the best way to do that. My email is Pavan, my first name, @blues.com. And I will obviously put you in direct contact with Francois to make sure we get these pilots moving. Well, with that, I wanted to say it's been a pleasure. Thank you all for your time this afternoon, at least afternoon in the United States. And we look forward to many more here. Francois, thank you so much for your time and for building such a terrific product that has had such a high impact.